Hello, hello, hello. This is Dr. Melva broadcasting live today. Welcome. Gonna see if I can get a strong enough signal. I'm at the ball field. The first one didn't work out, so I hope you can hear me. I hope you can see me. We are broadcasting live today. It is Thursday, October 19th, Breast Cancer Awareness Month. See if I can get in a good place where you can see me. For those of you just joining, I'm Dr. Melva, your board-certified radiation oncologist. I help people that have been diagnosed with cancer through my videos, speaking, and telemedicine consults. They will learn how to understand their diagnosis, have a caring and compassionate doctor, and navigate the cancer care system. You can find me right here on Facebook.com/Dr. DOCTOR Melva, MELVA. All right, so come on in. Let's do a little learning today. Today's topic. Now I'm at the ball field, so it's a lot of action going on behind me. I hope you can hear me. Today's topic are 3 tips. I will give you 3 tips to prevent breast cancer. Okay? 3 tips to prevent breast cancer. All right, so we have my little son joining me today. Say hey, Leland. Say hi.
Hi.
Say hi, everybody.
Hi, everybody.
All right, so we like to get down and dirty in the dirt at softball practice. So welcome, welcome, welcome. Come on in. Again, today we are broadcasting live from the ball field in Chesapeake, Virginia. And it is Thursday, October 19th at 6:30 p.m. Eastern. We are broadcasting live. Hopefully my signal is working and you can hear me. I have on my pink for breast cancer awareness today. Got my pink on, supporting all my survivors and thrivers of breast cancer. Went to an event earlier today, had a fabulous speaker. Welcome to the broadcast. Welcome to the broadcast. Dr. Sherry, got to meet her. Going to post some pictures later. She had very powerful words to share today. I was very inspired hearing her speak. It's always good to hear another physician speak, another speaker who is there to serve and to share. Thank you so much for joining the broadcast. If you're just joining again or catch me on the replay, I'm Dr. Melva, your board-certified radiation oncologist, and today we're going to talk about 3 tips to that worked out great. 3 tips to prevent breast cancer, okay? I'm out here doing a lot at the ball field, making sure no balls are coming flying past my head, so it's a little complicated. All right, now what we're going to talk about today may get overlooked. And a big reason for that is because we hear it all the time, okay? Everywhere we turn, we see it in the newspaper, we see it on TV, but I want you to hear it differently today. I want you to think about these 3 things I'm going to share with you and think about it the way it relates to cancer, okay? So number 1, stress. Let's get rid of stress, okay? Stress is slowly killing you, all right? You might say, how's that related to breast cancer, okay? It's a lot of ways, but for the sake of time, the one thing I want you to take away is that when you have extra stress in your life, it increases something in your body called cortisol, okay? C-O-R-T-I-S-O-L, cortisol. And when cortisol goes up, a good way to summarize it is everything else that causes havoc in our cells and our body also goes up. So if you remember back to the last time you had a science class or in school, you learned about fight or flight syndrome and fight or flight response. Okay, and that can save your life. It's very good. But to be in a constant state of stress, what we call chronic stress, it's not good. Okay, so increased cortisol, fight or flight. It also affects the amount of insulin in your body. All of these things, welcome to the broadcast. All of these things go together, and when you're living in a constant state of stress, it's killing you, and it's increasing your risk for a lot of cancers and also breast cancer, okay? So tip number 1 from Dr. Melva to decrease your chances of getting cancer, to prevent cancer, is to cut out your stress. That's so easy to say and hard to do. Let me tell you a story. Welcome to the broadcast. Thanks for joining. Almost every patient that I've seen, thanks so much for joining, Annette. Thank you for joining. Almost every patient that I have seen or treated can almost relate a specific stressful incident in their life before they were diagnosed with cancer. it's like so much science is so there, and it sounds, again, so easy just to say, oh, cut out the stress, or oh, stress causes cancer. Hi, welcome, highly blessed Dion, welcome. It's so easy to say because we all know, oh, I'm under a lot of stress. Oh, I need to cut my stress. But actually having a plan is something that you need to do. So number one tip to prevent cancer is we have to cut out our stress, okay? And the easiest way to do that, honestly, and this isn't going to sound very nice, but getting those negative people out of your life. Y'all know who I'm talking about. The negative news. Negative. We don't need the negative thoughts. We don't need the negative actions in our life. So get rid of stress. And one tip I'll give you for that is get rid of the negativity in your life. Okay, tip number two. Thank you for joining the broadcast. This is Dr. Melva. We are talking about 3 tips to prevent breast Cancer Awareness Month. All right, so tip number 2, the O word. Overweight, obesity, okay? Those words have been used all over. So we hear it so much that we just are kind of like, yeah, I'm overweight. Yeah, I'm obese. People know BMI, body mass index. Yeah, I have a big BMI. But I want you to think about that in relationship to your life and in relationship to your ability to decrease cancer. Welcome to the broadcast. Thank you so much for joining. Thank you for joining. So obesity, being overweight. Okay, so you ask why? How can this help me prevent breast cancer? Okay, when we have extra adipose, aka fat cells in our body, what does it produce? Does anyone know? What does it produce? Okay, it produces increased estrogen. And extra estrogen in our body feeds cancer cells, okay? It also creates increased insulin, okay? Sorry, I'm multitasking here. So we need to, thank you for that. So I hope everybody can hear me. I'm like moving with the light as the sun goes down. So number 2 tip to prevent breast cancer is to work on, this isn't very specific. These are short tips. We're going to have to get into specifics later, okay? But obesity, decrease obesity and overweight. So that means we're talking about diet, nutrition, lifestyle choices, managing if you have a diagnosis of diabetes mellitus type 2 and what you can do with that. So we want to keep all these extra hormone levels down in our body and normal, okay? All right, I hope this is helpful. Hope you're learning some things. Okay, tip number 3. All right, buddy. He's still over here playing in the sand. Where is he? You still doing okay, buddy? It's gonna be a dirty night tonight. Dirty night tonight. All right. You're okay? All right, buddy. Thank you. Okay, so tip number 3. Thank you so much for joining. Tip number 3. So we've talked about we're talking about 3 tips to decrease your chances of getting breast cancer. Number 1 was decrease stress. Get those negative people out of your life. Go ahead, let them go. Let them go. Okay, number 2 is your weight. Okay, thank you so much for joining the broadcast. Welcome. If you're just joining me, I'm Dr. Melva. Today we are talking about 3 tips to prevent breast cancer. Okay, and number 2, obesity, overweight. Number 3 is, I know you're gonna guess it. I know you can guess it. Exercise, okay? Exercise. Why do we need to exercise to decrease breast cancer? I'm gonna tell you a story. The breast cancer journals I get, the welcome Tamika, welcome Annette, thank you so much for joining. All of the breast cancer journals that I get, cancer journals, week after week. It is study after study after study, article after article from institution, from country about the link to obesity and breast cancer. The links to exercise decreasing breast cancer. So what we talked about, all those increased hormones, so increased cortisol, which leads to increased insulin and insulin growth factor 1. You'll hear all these terms thrown around. There's more and more evidence and studies that tell us exercise is protective against the negative benefits, or I'm sorry, not benefits, the negative reactions in your body to those hormones, okay? So when the bad things go up, thank you for that. Thank you for joining. Hi, Claudia. Thanks so much for joining the live broadcast. So, man, I tell you, I got to work on my focus. I got like a game over here, a game over here. a kid over here. See, women, we have to decrease our stress, okay? But I'm multitasking because I hope you're learning. I'm working on serving you and being a mom and a doctor and all that at the same time. So, all right, so let me go back to these articles, right? So what these articles are telling us, and the information that we know in our oncology community, is that exercise protects against the negative effects of those hormones. Okay, so when your body has increased insulin and increased insulin growth factor and increased cortisol from the stress that you're in because you hadn't let those negative people out of your life or those negative situations keep happening to you, exercise is going to be anti-effect of all those negative things. I'm going to post one of these days. It was a nice diagram from one of the studies I was looking at that really explained that. Okay, so if you're just joining me, it went from light to dark. I'm broadcasting live from Chesapeake, Virginia. Yes, son. I'm broadcasting live from Chesapeake, Virginia at the ball game. I'm Dr. Melva, your board-certified radiation oncologist. We covered 3 tips to prevent breast cancer. So number 1 is reduce stress in your life. Okay, you got to cut it. Chronic stress is killing you. Number 2, you have to pay attention to your body mass index, your weight. Welcome, Charlotte. Thanks for joining the live broadcast. Your weight, okay? Obesity, being overweight, is going to increase hormones in your body that will feed cancer cells, okay? Lots of evidence linked to that. And number 3, exercise, okay? The recommendation is that you get at least 30 minutes equivalent to walking 5 days a week. So about 150 minutes a week, okay, of exercise. And that will reduce your risk at least by 3% according to American Cancer Society, okay? So those are 3 tips. It's Breast Cancer Awareness Month. I'm Dr. Melva, your board-certified radiation oncologist. I help people that have been diagnosed with cancer through my video speaking, and I have a second opinion telemedicine online consultation service. You can check that out by sending me a message on facebook.com/Dr. Melva, DOCTOR, and I'm happy to set up a call with you and see if a second opinion with a caring, compassionate cancer doctor is what you need, okay? All right, let's go see the comments. Thank you so much for joining. Are we learning? Is this helpful? Can you hear me? Am I speaking too fast? Sorry, this glare is on here. All right, let's read the comments. Annette Walker says, hello. Hi, Annette. Highly blessed. Dion says, no, thank you. Highly blessed says, amen. Amen. That's right. You must have been talking about those negative people when I said that, right? Get them out of your life. Annette said, I've been stressing nonstop lately, so this is scary. All right, Annette, what is your plan to stop stressing? Okay? 3 things you can do right now to stop stressing your life, Annette. Number 1, get the negative people out of your life. Number 2, turn the TV off. Don't let negativity into your life. And number 3, write down what your stressors are and work on a plan to get rid of them. Okay? All right. So Tamika says, thank you for the tips. Thank you, Tamika, for joining. I hope they're helpful. All right. Annette says, how can I reduce my estrogen levels? Okay. So Annette, reducing estrogen levels, that's probably a whole nother talk. But I guess, how old are you? Are you taking any hormone replacement therapy? Have you had childbirth? Your weight is one way. So lots of questions that we could talk about. Okay, let's see. Sorry, I'm looking. Hope that helps. Claudia says, hey, Dr. Melva, thank you. Hi, Claudia. Thanks so much for joining. Charlotte says, wow, great tips. Thank you. Thank you, Charlotte, so much for joining the live broadcast. And Claudia says, yes, very useful information. Awesome. Okay, I have a few minutes for questions. Does anybody else have any other questions for me? If I can't answer them, I will get them to you. Again, if you need a caring, compassionate cancer doctor that will make sure you understand how to have a healthy lifestyle, prevent cancer if you don't have it or if you don't want it to come back, if you need a second opinion because you've been to a healthcare system and you want to know, is what they're telling you right? You want to understand what they're telling you. Go to facebook.com/Dr. Melva and click send message, and I will send you a link to schedule a time with me and see if a second opinion consult is for you. All right, let's see if there are any other questions. All right, Claudia says, if you are premenopausal, should I take anything? No, right now there's nothing that you should take. There are, honey. Who needs a 3-year-old tonight? So there's not necessarily anything that you should take. There is evidence in women who are at higher risk. So if you have had a mammogram or you have a family history or you fall into a high risk category of women, which that would be, more of a one-on-one consultation or conversation. I need to know a little bit more about your family history. Or if you've been diagnosed with a hyperplasia, it's called atypical ductal hyperplasia, ADH. There is some evidence about taking some anti-hormone treatments, okay? So right now, without a lot of information, I can't really answer that question, but yes, in women who are at higher risk, there are things that you can do or take for cancer prevention, okay? Is that helpful, Claudia? Let's see what Claudia says, if she's still on. All right, any other questions? I hope you learned a lot. Again, if you're just joining, I'm Dr. Melva, and these were 3 tips to prevent breast cancer awareness month. Got on my purple. We're out here at the ball field. Everybody's getting their 30 minutes of exercise. All right. Let's see if I can walk over here a little bit. Okay, yes, she said that. Thanks. That was helpful. Okay, thanks so much. I'm going to sign off. Oh, wait, is there another one? Annette says, thank you. This was much needed. All right, Annette, check me out if you're not already on my Facebook. Send me a message if you think that this was helpful. Please share. Sharing is caring. And we will see you again next Thursday at 6:30 p.m. Eastern for Cancer Chats with Dr. Melva. Thank you so much. Signing off. Good night. Good night. Thank you for joining. Bye.